Can I come in?
Yeah.
Hi, my name's Lauren. I'm a beginner's practitioner today. Before we get started, do I have your consent to film and perform this exam?
Yes.
Okay, perfect. Let me wash my hands really quick. I'm going to go ahead and start by assessing your temporomandibular joint. So if you could just open your jaw for me, that would be great. Wonderful. Any pain?
No.
Any cracking sensations?
No.
All right. No crepitus noted. I'm going to have you clench your jaw so I can assess your masseter muscle. All right, everything feels nice and good there. Now I'm going to go ahead and have you stand up so I can assess your spine. Turn around, and if you could just take your shirt off for me. Okay, wonderful. I am going to go ahead and just inspect your spine. Everything looks nice and midline, symmetric. I am going to go ahead and palpate, so let me know if there's any tenderness. Any tenderness?
Nope.
Okay, wonderful. I'm going to go ahead and do some tests of your cervical spine range of motion. Just turn around for me, and then if you could just look down, and then look up, and look side to side, and then do ear to shoulder. Wonderful. I'm going to have you do these again, but do them against some strengths. So if you could look down, wonderful, and then look up, perfect, and then look to the left, and look to your right. Perfect, strengths are intact. I am going to go ahead and take a look at your lumbar and thoracic spine. Do some tests. If you could turn around, move back for me. Okay, wonderful. Now go ahead and try to touch your toes, but don't bend your knees. All right, your spine looks nice and midline, nice and symmetric. Everything looks good. You can go ahead and stand it back up for me, and then lean back as far as you can. Wonderful. And then if you could lean to each side, your left and your right. Good, good. And then if you can twist to each side. Good. Range of motion is intact on all sides. All right. If you want to go ahead and have a seat back for me, I'm going to go ahead and just move on to your upper extremities. I'm just going to take a look. I'm not seeing any, obvious masses, deformities, anything that I should be aware of. I'm going to go ahead and start palpating. So let me just feel on some of your joints. Let me know if there's any tenderness. Elbow. And move up here to your shoulder. All right. Now I'm going to go ahead and assess for your range of motion, starting with your fingers and your wrists. So if you're able to move your finger up and down, and I'm trying to do against resistance. Okay, good. And then how about your wrists up and down? Against resistance. Good. Now I'm going to have you do some more range of motion. Spread your fingers out and put your fingers back in. And then if you're able to touch your fingers to each. And good. And then make a fist. And then are you able to go back to this position and move in and move out? Okay, good. Looks like you have full range of motion and strengths. We're going to go ahead and move on to your elbow. I'm going to have you go ahead and flex and extend. Good. And then against strengths. Good, wonderful. Again, this arm. Good. And then if you can just take your arm like this, and then are you able to go one way, back to center, and then the other way. Okay, wonderful. Looks like full range of motion of that elbow. Now we're going to move on to your shoulders. Are you able to do a shrug shoulder for me? And then are you able to raise your hands up and go all the way back behind and extend as far as you can? Wonderful. And then are you able to cross your arm in front of you? And then the other arm. Perfect. And then take these hands behind your back, elbows out, and above your head, elbows out. Wonderful. I'm going to go ahead and range of motion looks to be fully intact. I am going to go ahead and assess your strengths. So shrug your shoulders. Wonderful. Okay, good. I am going to go ahead and check for your distinction of sharp versus dull. So I'm going to do sharp or dull, and you just let me know. Close your eyes. Sharp or dull?
Sharp. Dull. Sharp. Sharp.
Okay, perfect. Sensations are intact. I am going to go ahead and take a look at your capillary refill real quick. So if you just want to give me your hands. Less than 3 seconds bilaterally, everything looks good. And I'm going to go ahead and check for your reflexes. I'm going to start with this brachioradialis reflex, and then your bicep, and then your tricep. Take this arm here. Wonderful. And we're going to do the other side. Brachioradialis, bicep, and tricep. Perfect. Now we're going to go ahead and move on to the lower extremities. I'm just going to go ahead and assess. I don't see any obvious, malformations, any deformities. I'm going to go ahead and palpate, so let me know if there's any tenderness. Is there any tenderness?
Nope.
Okay, wonderful. I don't feel any warmth, any pain, or no pain noted upon palpation and no crepitus, so that is good. I'm going to go ahead and do the sharp versus dull. You can just tell me if it's sharp or dull.
Dull. Sharp. Dull. Sharp.
Perfect. Sensation is intact. And then I'm going to go ahead and check some of your hip reflexes, so if you are able to go ahead and lay down for me. Wonderful. And I'm going to go ahead and check your hips, so if you are able to lift this leg up straight. Wonderful. And then do it with a flexed knee. Good. And then are you able to take that knee inward and then straighten it and go outward? Good. Now do that flex knee again. I'm going to press it against and apply some strength. Wonderful. Strengths are present. Now I'm going to have you flip around so we can do the other side. And if you could just lift this leg up straight for me. Wonderful. And then do it again with the bend knee. I'm going to check your strength. Wonderful. We're going to go in and out. Straighten this leg and check this outward motion. Perfect. Looks like your hip strength and range of motion is equal bilaterally, which is good. If you just want to go ahead and flop onto your belly and then lift one leg as far as you can, one leg at a time. Good. And then the other leg. Good. Full range of motion of your hips. If you want to go ahead and go back to the seated position, I'm going to look at your knees. And if you just want to bend your knee and then straighten your knee, wonderful. And we're going to try to do that against some strength. So good, and against strength. Get strength again. Good. Get strength. Good. And then we're going to do this side and against strength. All right, strength is equal bilaterally, range of motion is equal bilaterally. We are going to go ahead and move down to these ankles. I'm going to have you do what's called plantar flexion and dorsiflexion. Dorsiflexion is a flexed foot, so go ahead and put those feet in flex position. These feet out for me. Flex position, good. Now point position. Now against strengths. And push, good. Now I'm going to have you do eversion and inversion. So if you want to take your foot back up and then inversion, try to move them inward, perfect, and then eversion outward. Perfect. Just a little bit. Eversion, good. And then the next is I'm just going to have you stand up, and I'm going to take a look at how your weight bearing. Looks like you are equally, weight bearing on all 10 toes. I don't see, any malformations. Looks like you are in line with your tibia, so that is good. If you want to go ahead and sit back down for me. And then if you want to flex your toes and curl back up. Wonderful. I am going to go ahead and palpate on these joint muscles, on your metatarsals, and then check for capillary refill. Bilaterally less than 3 seconds, so that's great. I am going to go ahead and palpate for this Achilles tendon and check for your Achilles tendon reflex. Wonderful. And then if you could hang this knee so you're not, sit back a little bit for me. There we go. And then I'll check for your patellar reflex. All right, wonderful. And then last thing is I just need to fill on this again. All right. Everything feels nice and good. Do you have any questions for me today before we end this exam?
I do not.
Okay, perfect. Look,